Thank you, Chair. I know from talking to nurses and doctors at the Queen Elizabeth Hospital in King's Lynn how affected they've been from dealing with the emotional trauma of treating patients with COVID and being with them in their final moments. So I want to ask a bit about mental health. And to Simon, how is the NHS looking after the mental health of its employees?
Sir Simon Stevens.
Thank you, and you're quite right about that. This has obviously been a period without parallel in the professional and personal lives of everybody working in the health service, particularly those people who have looked after more than 101,000, mainly older people who've had emergency hospitalisation for coronavirus. And so part of the response has got to be ensuring that there is targeted psychological and mental health support available for staff across the health service. Last year, we, for the first time, introduced a dedicated practitioner health programme, a mental health programme for doctors, but we're asking those supports to be extended more widely by trusts and into primary care. And then for particular staff groups where their experience may have been different as well, for example, nurses from a Filipino background, we have been nationally putting in place particular helplines and support for them as well. But look, nobody has been unaffected, untouched by this. That's true in our personal lives as well as our professional lives, and you're quite right to point that out.
And how are you tracking that picture across the NHS, and what kind of picture do you have at the moment, and what's your forecast in terms of cases of PTSD that you think a proportion of the workforce might come forward with?
Well, in fact, I was talking about that very topic on Friday with Professor Sir Simon Wesley, who's the Regius Professor of Psychiatry down at the Institute of Psychiatry in King's College, London. And I think it's fair to say that, on the one hand, there is an expectation that there will be increased anxiety and mental distress as a result. But PTSD in particular has obviously a very diagnostically precise term, and the advice from some other sort of equivalent areas is that actually it might not be PTSD specifically that we need to respond to. So part of what people like Professor Wesley and others are doing are actually tracking mental distress as distinct from mental disorder on the part of staff across the NHS, so that we can better design a mental health support offering that my colleague Claire Murdoch is working on doing.
Thank you.
Right, James. I mean, even before the crisis hit, obviously mental health absence was an issue. You paused the people plan back in March. Do you have a date for when that's going to be published?
Well, in a sense, we've been getting on with a number of the building blocks or the elements of the people plan regardless, and one of the consequences actually of coronavirus over the last 3 months is that a lot of the things that we were planning on doing in the health service we have fast-tracked in a very flexible and agile way. The people plan itself is not just about the support for our current staff, it's also about the funding that we discussed last time, I think, for education and training expansions that Health Education England will be bringing about. And that's obviously a discussion we're having with the Department of Health and with government. But those aspects of the people plan that we can get on with as the NHS, we are getting on with.
That's good to know, because the interim plan didn't actually refer particularly to mental health. It talked about shortages of mental health services, nurses and other professionals, but there wasn't a particular focus on treating mental health. If I could just turn to the wider population, obviously shielding, like other MPs, I get a lot of emails from constituents who are struggling loneliness and other challenges. What's your assessment of the problems that we're going to see in the wider society from mental health issues? Do you think this is just a temporary thing, and once the lockdown lifts, that people will be healthy again?
Well, again, the gold standard for mental health research in this area is actually doing interviews rather than online surveys. A lot of the reports to date have been quite small sample online surveys, so I don't think there's a good empirical fix to answer the size and shape of the problem, but we do believe there will be extra pressure on mental health services, and as a result, we're going to need to fast track some of the service expansions that were already in hand as part of the long-term plan.
Okay.